Welcome to another episode of the Sage Holistic Show. My name is Emily Sellis and I'm your host. Today I'm bringing to you another episode from one of our holistic healers of Orange County. Her name is Katina Laib. She's a licensed marriage and family therapist and she is a specialist in dialectical behavioral therapy. So this is also called DBT, and it is a therapy that's used for people who have really big emotions, really strong emotions, who are deep feelers, deep thinkers, and really need some support in making sense of their world. So today Katina is going to be talking about this, sharing about this, and she's all going to add a little twist in there from a Christian lens. So have a listen, and would look forward to hearing from you in the comments below what stuck out for you, what your takeaways were. Have a listen. Sage is a 501c3 nonprofit organization building community by providing education and counseling about physical, mental, and spiritual well-being. We encourage all of our listeners to find their own path to what holistic wellness means to you.
This is such a warm and inviting and encouraging group, so I'm really happy to be able to share and learn from you guys too. I made some slides on Canva. However, when I present on Canva, it blocks you guys out, and I want to see your faces. So I am going to share the PDF, which is not as professional. I'm going to be scrolling, but let's just see how that goes. Let me see. So PDF. All right, is it working?
Yes, it is.
Okay, awesome. Great. Okay, I'm going to try to make it bigger so you see one slide at a time, but okay. Okay, I think you guys are just going to see kind of like one and a half slides since I'm showing the PDF. But anyway, a little bit about me. So I'm Katina Laib, a licensed marriage and family therapist, and I have a private practice. I'm hybrid right now in Placentia. So I do have a physical office in Placentia, and I also see people through telehealth. I work with teens and a lot of young adults and also adults as well. I also see a lot of Christians. Not all of my clients are Christians, and a lot of them are. I am certified in dialectical behavioral therapy through the Linehan Board of Certification. And so I do specialize in dialectical behavioral therapy, and I'm going to explain a little bit about what that is. I do have to say my downfall is that I like to share a lot of information and pack it in, and I don't know if I can cover everything. That's my downfall. So I think we may not have time to cover everything, but I'm going to make sure we hit the main things, and we're going to go over what DBT is. I also kind of want to say that I think with anything like integration of someone's faith or spirituality and therapy, that is very unique, of course, to the person and also to the therapist. So I also want to say this is a way that I have done it with different clients that I've worked with. And I'm just going to give kind of examples of how I do it. It's not like, there's not like a protocol of how you do it. DBT, that's not specifically for Christians. There's a pretty specific protocol. And when I integrate, I do use the principles and the protocols of DBT, and it can look very unique. So so that's a little bit about me. And I'm just going to go over, here's a little bit of an overview. So I'm just going to talk about what is DBT. I don't really have to talk about why to integrate spirituality a lot, because I feel like I'm preaching to the choir. You guys know how important it is. And I'm also going to talk about what dialectics is, because dialectical behavioral therapy, it's a core part of DBT. And so I want to talk about like, what is dialectics? And the core of dialectics is acceptance and change. How do you balance and hold acceptance and change in DBT, and particularly with Christian clients? And then I might touch on like an intervention that I use for how do you foster acceptance from God and from self. And then also there's a lot of different change strategies that DBT uses. And I might touch on like an example of a change strategy that I may use with a Christian that I might adapt. So that's a little bit of an overview. So what is DBT? Dialectical Behavioral Therapy. So it was developed by Marsha Linehan, and it was developed for basically very hard to treat cases where a lot of therapists wouldn't want to work with them. They would be hospitalized a lot. They would have multiple suicide attempts. Personality disorders, self-harm, substance use. And so these are really hard to treat cases where a lot of therapists might burn out or they might drop out of therapy. And so Marsha Linehan started to do research and meet with these type of clients to figure out what works for clients who struggle with these emotional and behavioral issues. And DBT works really, really well for people with very big emotions. So these are people who are deep feelers. Their highs are very high, their lows are very low. When they feel something, they feel it for a long time, and it takes a long time for them to get back to baseline. And so like, if I see a client who fits really well with DBT, a lot of times they might be artists. They might be very deep, musicians. They're very deep feelers. So it was developed for these clients. And then they found through research that it actually works for a lot of different kinds of clients, even ones that are not as, I guess, severe, you would say. So anxiety, ADHD, depression that's hard to treat. And there's a lot of research that has been done, a lot of RCTs that have shown how effective DBT is. So a little bit about just kind of the basic structure of DBT. There's 4 modes of DBT, of standard comprehensive DBT. So the first mode is individual therapy, where you meet with the client one-on-one. And the metaphor I like to use is, okay, like if you're learning to drive, this is when you are meeting your instructor, and the instructor is basically guiding you and coaching you and helping you keep to your goal of learning to drive. And so that's individual DBT. Skills training is a class. It's more like a psychoeducation format. So we go over, each class goes over a different kind of skill. So this is where this is kind of like driver's ed, where you sit there and you learn the rules of the road. And then there's phone skills coaching. And that is to help the client in their daily life apply the skills that they learn. So my clients can text or call me, and it's very short. I tell them it's usually 5 or 10 minutes, where if they're in, they don't know what to do, they need to apply a skill, they're feeling very overwhelmed, they can contact me and I will coach them on a skill that they can use in the moment. Because a lot of times you might learn something in therapy and you're feeling calm and you're like, oh, I get it. But when you're like in it and you're feeling so overwhelmed, you don't even know what to do. And so that's what phone coaching is for, to help you generalize skills in your daily life. And then the fourth is consultation team, where the client is not part of this, but the therapist is actually part of a team, because especially when you work with such severe issues, it's really important for the therapist to also have support and feedback. And this is standard DBT. I do want to say right now, I used to work in a standard DBT clinic, and because I'm not in a clinic right now, I'm not doing standard DBT. I do provide a skills training group and phone coaching, individual therapy, and I do get consultation from like an expert, a DBT expert, but I'm not on a team. So that's standard DBT. It's very comprehensive. And then I mentioned that the class teaches different skills. And so DBT believes that what's missing a lot of times is when these clients have such overwhelming emotions, they need to learn skills on how to manage them. And so there's 4 sets of skills that we teach. And so the first is mindfulness. It's being aware of in the present moment without judgment. And mindfulness permeates all the other skills. It's kind of the foundation of DBT. And then there's the 2 acceptance kind of skills are mindfulness and distress tolerance. Distress tolerance is pretty much, how do I get through a crisis without making it worse? And how do I accept things that are really difficult and that I don't like in life and still live it and accept it? So this is the acceptance side, the set of skills that we teach in DBT. And then the change set of skills are emotion regulation. How do you understand your emotions? How do you change them? How do you reduce vulnerability? And actually, like that, there's something called the please skills, which I think the like Bonnie would appreciate, or that our more somatic kind of therapists would appreciate, which is about taking care of your body in order to take care of your mind. So that's please skills. That's part of the emotion regulation skills. And then there's also interpersonal effectiveness skills. So it's basically, a lot of it is assertiveness skills of how do you ask for what you need? How do you say no? How do you balance keeping the relationship and also keeping your self-respect? So those are the different skills that are taught in DBT. So I just wanted to briefly go over that, what DBT is. And I feel like with 20 minutes, I could just talk about DBT and not even talk about how to adapt it to Christians. And it would just be a kind of a general overview, but that's a little like touch on the basics of DBT. But going more in like how I adapt it with Christians. And so I work with a lot of Christians right now in private practice. So the first thing, of course, I don't have to read through these questions. You can kind of look at them, but I definitely do a lot of assessment and informed consent, because just because they say they're a Christian, I don't really know what that means. Like, how important is that? to them? Like, how do they practice it? Like, what do they believe? How do they actually want that to look like in therapy? So I make sure I go through that with my clients in the beginning, just so ethically we, when we integrate, they feel like, yes, this is really meets me where I am, and this is what I believe. So those are some of my the questions that I ask. And so I'm going to go over a little bit about what dialectics is. So it's part of the name. So dialectical behavioral therapy. So the therapy is behavioral in that it looks at problematic behaviors like suicide attempts or suicidal thoughts or drinking, shutting down and escaping, right? And so it focuses on how do we change those behaviors. So that's the behavioral part. There's a lot of you probably know about cognitive behavioral therapy. That's a really common behavioral therapy. But what was happening was Marsha Linehan, as she was working with these clients with very intense emotions, when she would do behavioral therapy with them or cognitive behavioral therapy, they would be like, wait, you don't get it. Like, yeah, you're saying that my thoughts don't make sense, but you don't get it. I feel it so deeply. And they would feel invalidated, pretty much. And so what she found was dialectics was so important, which is just a short definition would be the synthesis of two seemingly opposite ideas, forces, or concepts. So she might go to him and she might go to a client, or we might go to a client and say like, wow, like I get that this is so hard. It is so hard. Like this situation that you have is so hard. It's so hard to change. And at the same time, it's leaving you in a place where you're feeling stuck, right? And so it's holding two things together. And so some examples of dialectics that we help clients hold is, how do I accept myself and change myself, right? There's some therapies. One reason why I was really attracted to DBT was that I was trained in some therapies where it was pretty heavy on acceptance, and a lot of my clients felt really safe. We really connected, but I didn't see a lot of change. It was really, really slow. And then I actually worked at a place where, they were very heavy. It was more cognitive behavioral. It was more short term, and the emphasis was on changing. There were some interventions that there would be change. And yes, but then sometimes clients would dig their heels in, like, you don't get it. You're not accepting me. You're not meeting me where I am. And so really the heart of DBT, of dialectics, is acceptance and change. And it's just a dance when you're working with a client and you're doing DBT. And you can see like some other kind of examples of dialectics that we might hold together. A lot of clients that come in they're like very either or. They're like, well, it's either this or it's either this, right? And so you're helping them be flexible. So the next slide is just kind of, again, the heart of DBT is acceptance and change. Accepting yourself in the present moment, even when it's extremely difficult, and then striving to change your behaviors and gain skills in emotion regulation. So I want to kind of talk a little bit about, what does this specifically look like when you're in a Christian population and when I'm working with Christians. I want to share a story. So the developer of DBT, she's a very spiritual person. So a very devout Catholic, and she's also a Zen master. And so she actually when she was a teen, she was hospitalized for, I think I want to say 2 years. And she was the most severe patient on the unit, where like they had to like watch her 24/7 or else she would try to kill herself. But anyway, when she was a young adult, she got out of the hospital and she was at church, and she was really struggling with with all these emotions, and she was hating herself. And she said she was at church, and this is a quote from her. She said, "One night I was kneeling in there, looking up at the cross, and the whole place became gold. Suddenly I felt something coming toward me," she said. "It was the shimmering experience, and I just ran back to my room and said, 'I love myself.' It was the first time I remember talking to myself in the first person. I felt transformed." So this was the moment where she felt acceptance. And she said this was actually the turning point of when she was able to start to change. And so DBT really says you can't change until you accept yourself. You can't change a situation until you accept the situation, right? So this is so important. And as Christians, what does this look like? So this is the next quote by I don't think he pastors a church anymore, but he's a Christian leader. And this is a quote from him, Tim Keller, and he says, "The gospel is this: we are more sinful and flawed in ourselves than we ever dared to believe. Yet at the very same time, we are more loved and accepted in Jesus Christ than we ever dared hope." So you can see the acceptance and change in this quote. So for those who are not familiar with what Christians believe or what the gospel is, it pretty much is saying Christians believe that, okay, there is something really broken about us. And God created us to be in a certain way, and we haven't met that standard, right? So we need to change. The consequence of this is that we're separated from God, and the consequences of it is death. The good news is that God loved us, so he sent his son Jesus to die for us and take our place, so that if we believe in Jesus, we don't need to be separated from God. Through Jesus, we are completely accepted. And we don't need to, and through God, he through his power, we can change. So, as Christians, when I work with Christians, this is something that I hold all the time. It's not necessarily like we talk about all the time, but it permeates our sessions together. Just like when I'm working just in general in DBT with dialectics, acceptance and change, it permeates our sessions. So, if a Christian client is feeling super like shamed and they feel so bad about just what happened, and truly maybe they did really hurt someone in their actions, right? And maybe they self-harmed, they had a suicide attempt, or they yelled at someone and they hurt them. Yes, they need to change. If they continue those behaviors, right, it's going to continue to hurt themselves and to hurt other people. At the same time, you remind them that, hey, if you believe in Jesus, there is no condemnation. He completely loves you and accepts you. And so you hold this together. And so that's what I do when I work with Christians. And that's the main way of what dialectics looks like when I'm working with a Christian. I'm just trying to see, how am I on time? I have like 5 more minutes. Is that right? I'm trying to.
So there's 5 more minutes, but that's okay. For, I think, right, Emily? That's for some Q&A. we want to leave some time for some questions at the end. Let's see.
Yeah, I mean, sometimes presenters will use the whole time to present, and then there's no time for questions and answers. It's up to you, and if you want to open it up for questions and how you want to play it.
Okay. Let me just see. Okay, let me just take a couple minutes. I won't go into the details of these slides, but just to go over, this is an example of acceptance strategies. Is pretty much validation. And some interventions I might go over with people is, okay, of course, validation with a therapist is very healing. And ultimately, a lot of these clients, they need to learn to accept and validate themselves and to receive validation from God, even if they're not getting it from other people. And so there's different ways that I might help clients do that. And then there's also change strategies, and there's a lot of different change strategies that we use in DBT, but I will adapt different. This is like a worksheet that's part of the DBT skills manual. And so a lot of times, some of the skills that we learn that are change strategy skills, I will adapt it as to Christians. And so this is an example of you're using paired muscle relaxation. So it's the body. And then you're also identifying these core thoughts. And then you might reframe those thoughts to something that God has told you, right? Something that God is telling you is true. So that would be an example of like maybe a change strategy that I might use with a Christian. And then this is just my contact info if you want that. So I'll just put that there. But yeah, I guess we have like a couple minutes for questions. So I'll just open it up for questions.
Katina, how often are you doing like phone skills with clients? I was curious about that. That was really helpful to see like the big picture of treatment that you do with clients. So like how often are you doing like those phone skills coaching sessions? I guess that's my question with clients.
Yeah, Emily,
Seems like she's frozen.
Yeah.
Darn it. Maybe she's coming back in.
Yeah, I was curious about the same thing that I wrote down, like this.
Yeah.
That seems like a really unique offering.
Yeah.
It's really nice.
okay, can you guys hear me or see me?
We can hear you. I don't know if I can. There you are.
You're frozen.
Okay, I'm going to try to come back.
Dick is frozen.
Yeah.
Okay, I'm going to leave and come back.
But we can hear you.
Can you guys see me or hear me?
We can hear you.
No.
But your image is frozen. Oh, there you go. I think you're back.
There you go. You're back.
Okay, am I back now?
Yes.
You guys hear me and see me? Okay, good. Okay, Emily, I think I caught your question, which is how often do I do phone coaching? Was that your question?
Yes. Yep.
Okay. Okay, so honestly, most clients underutilize it. They don't use it when they need to. I know a lot of therapists, when I first started with DBT, I don't know if it was kind of your question or your concern. I was like, oh my gosh, like, I really wanted my off times. Like, what if they call me all the time? Like, I remember I had all those like kind of fear thoughts in my mind. And the thing that they found with is, especially with borderline personality clients, when you actually provide phone coaching, and I have a phone coaching contract, so it's very clear and structured. It's 5 to 10 minutes. This is how it is. It's very directive. It is not therapy. And so we're very clear on what it is. It's not like you just talk to me for an hour, like on the phone. People tend to understand what it's for. And most of my clients, I would say, don't use it enough. Like, there will be things that happen in the week, and I'm like, why didn't you contact me for phone coaching? Like that would have been really helpful. And most of them, most of my clients, maybe because they're not used to it and they don't want to burden you, they don't actually use it when they need to. Occasionally, I will have clients who use it more than I think is effective or helpful. And then I have that conversation with them of like, okay, like, yeah, like this is, and the strength of DBT is you are very upfront about anything that burns you out or anything that burns them out. And so you talk about it in a very non-judgmental way, and you work through it. So I don't know if that answered your question, Emily, just how often. I didn't catch all of the questions.
Yeah, that was really it. I was just curious like how often that's used for these clients that are having these really intense emotional experiences. I could see that being really helpful, but wondering how, like, if you charge more, like even from a perspective.
I do charge. I think every clinic does it differently. So for me, I mean, I decided that if it's less than, cumulatively, if the phone call is less than 20 minutes per week, I'm just not going to charge it. But I know, like the previous clinic I worked at, they would charge like per minute. So, you know, you just kind of decide on how much you charge. And then after that, but honestly, since I've been in private practice for a year, I don't think none of my clients have actually overutilized it to the point where I'm like, I feel like I'm getting gypped and I need to charge more. So I haven't run into that problem yet. Yeah.
Yeah, that's interesting. That's fascinating. I mean, I guess I would worry because I have 3 young kids and like my availability. So I guess someone who's doing DBT in this fashion there is kind of an availability that you need to have for your clients to be able to do that phone skills coaching.
It's true. Yeah. And you have to decide what your limits are. So for me, for clients that I think really need to be in a clinic and a team setting, and I think they're going to utilize a lot of phone coaching. Like I also have a toddler. So I actually don't think I would be able to be on the phone all the time. So when I assess or I screen on the phone, I also kind of assess like, oh, do I think this is a client that might need to utilize a lot of services and need a bigger team setting? And then I might refer them. Thank you for spending some of your time today with us at Sage Holistic Health and Wellness Center. If you like what we're all about, please consider supporting our nonprofit organization by making a tax-deductible donation. To do this, you can go to our website at www.sagewellnessctr.org and click on Donate in the upper right-hand corner. We look forward to spending some time again with you real soon. Take good care.